You know, if you've ever dealt with chronic pain, you know how incredibly frustrating it is. The injury should be healed, right? The problem should be long gone. But for some reason, the pain just sticks around. Today, we're going to dive into a completely different way of looking at this. It's a root cause approach that asks a fascinating question. What if the problem isn't the original injury anymore, but the fact that your body has actually learned to remember the pain?
Okay, so let's start with this huge question right here. I mean, this is the one that sends people from one doctor to the next, just searching for an answer that clicks. You know the tissue should have repaired itself by now, so why on earth does it still hurt? Well, it turns out the answer might not be in the tissue at all.
And this slide right here illustrates the first crucial idea we have to get our heads around. We usually think of chronic pain as just, well, acute pain that just won't quit. But it's not. According to experts like Dr. Joni Chapman, it is a completely different beast. See, acute pain, that's a straightforward signal of damage. But chronic pain, that lives in the nervous system. It's a pattern that gets wired in.
So this brings us right to the heart of the chronic pain problem, the way it's usually handled. For millions of people, it's just this endless cycle of frustration, of feeling unheard and totally misunderstood by the conventional medical system.
Now, does this sound familiar? I mean, Dr. Chapman just nails the experience so many people have. Take a pill, get some rest, and we'll see. It's such a passive approach, you know? It treats the symptom, sure, but it never really asks the most important question. Why is the pain there to begin with? It's completely missing the point.
And that misunderstanding right there is exactly why the old treatments so often fail. It's not just that they're a little ineffective, they are often targeting the wrong thing entirely.
And what's so fascinating here is the massive disconnect this points out. We put so much faith in an MRI or an X-ray, right? But those things only show structure. It is absolutely possible for your scan to look perfectly normal while you are still in a world of pain. What's so often missed is a really thorough, hands-on physical exam, one that actually looks at how you move, how you function. That's where you find the tissue restrictions and the real story of your pain.
So here's the bottom line. Painkillers might feel like a solution, but all they're really doing is muting the alarm bell. They do absolutely nothing to put out the fire. And that underlying issue, a haywire nervous system that's just gotten way too good at sending pain signals, is left completely untouched. The second that medication wears off, the system just picks right back up where it left off.
And this brings us to what is really the aha moment of this whole thing. This is the idea that changes everything. It's that your body doesn't just have pain. Over time, your body learns pain.
The scientific name for this is central sensitization. Now, it sounds really complicated, but the idea is actually pretty simple. It's like your nervous system's alarm gets stuck in the on position. It just becomes so good, so efficient at feeling and amplifying pain that it keeps on screaming danger, even when the original threat, the injury, is long gone.
You can kind of think of it happening in steps. First, there's that initial injury, right? Sharp, clear pain. But if it sticks around, the nervous system starts to adapt to it. Then the pain itself might start to morph. It becomes dull, or it spreads out. Maybe it even moves around. By this point, the whole system has recalibrated itself. Pain has become the new normal.
And like Dr. Chapman says right here, the whole goal has to shift. It becomes about helping the body unlearn that pattern. The pain is absolutely real, it's just not coming from where you think it is anymore. The focus has to move from the old injury site to the nervous system itself.
Okay, so if the real problem is a sensitized nervous system, then how in the world do you help it unlearn pain? Well, that's where a holistic root cause toolkit comes in. It's designed to treat the whole system, not just the symptom.
So, Dr. Chapman's approach is what's called multimodal. It combines a bunch of different therapies that all work together. We're talking about acupuncture and electroacupuncture to help regulate the nervous system, cupping to release those tight tissues, and even things like herbal medicine and functional nutrition to cool down inflammation from the inside out.
So let's zoom in on just one of these tools for a second. Electroacupuncture. It's pretty much exactly what it sounds like. It's traditional acupuncture, but with a very mild, gentle electrical current added to the needles to basically supercharge the effect.
And why is this so incredibly effective? Well, research actually shows that electroacupuncture can directly push back against that central sensitization we were talking about. It helps the nervous system hit the reset button, recalibrate its pain response, and finally dial down that overreactivity. It's a direct fix for the root cause.
And it doesn't just stop there. Functional nutrition plays this huge role because, well, chronic inflammation is like throwing gasoline on the fire of a sensitized nervous system.
So by figuring out the dietary factors that are promoting inflammation, you're literally taking away the fuel source and helping your body break that pain cycle from a whole other angle.
So, where does all this lead? The ultimate goal of this entire journey isn't just about managing pain day to day. It's about unlearning it for good, about creating a real, lasting change in how your body works. At the end of the day, this is about triggering genuine physiological changes that stick. Think about it. It's the difference between just turning down the volume on a shrieking smoke alarm versus actually going in and putting out the fire. One is a temporary fix. The other is a true resolution. This quote from Dr. Chapman just perfectly sums up the entire philosophy. It's not about fighting your body. It's about helping it reset, helping it restore its own natural balance, and reactivating its amazing innate ability to heal from within.
And that leaves us with this one last powerful idea to really think about. For so long, the approach to pain has been a battle, right? Block it, fight it, suppress it. But what if the best, most effective path to healing isn't to fight at all? What if it's actually a gentle process of helping your body forget the pain it learned to remember?
I stopped trying to find a doctor who would listen, and I did this instead. For years, I was doing everything right. Eating clean, exercising, getting 8 hours of sleep, but I was still exhausted. I had constant brain fog, and my hormones felt completely out of whack. Every doctor told me my labs were normal, and it was probably just stress. I was about to give up until I found Holistic Health. It's a free AI wellness tool trained by functional medicine experts. I spent 5 minutes answering questions about everything: my symptoms, my sleep, my digestion, and it built me this. And this was the light bulb moment. It didn't just give me a list of problems, it connected the dots. It showed me how my gut health was likely impacting my hormones and how that was causing the fatigue and the brain fog. It even gave me a clear list of potential root causes, supplements to research, and even the specific lab tests to ask for. Its tip is secure. Over 77,000 people have used it, and it's 100% free to get your blueprint. If you feel like you're not being heard, start here. Understand your body first and then decide your next step.